And then the second question from Ms. Mendez is, when is it safe to sleep on the operative side after total hip or total knee replacement? And then how do patients get better sleep in general after total joint replacement surgery? Those are excellent questions. These are questions I get all the time in clinic. Let's just start by tackling the first one, sleeping on the side of surgery. Usually most surgeons do not like you sleeping on the side of surgery, more so with hip replacement than knee replacement. But hip replacement, usually about 6 weeks. And the reason is this. After hip replacement, if you're lying directly on that side to sleep, number one, it's usually fairly uncomfortable. And number two, it adds some shear forces to the incision and the tissues around the hip replacement. It can cause some fluid collections, and it can cause some wound complications as well. So I tell most people to avoid lying on that incision for at least 6 weeks. And then after that, you can start to lie on that incision as it's more and more comfortable. Now, the first few times that you lie on it, it's probably going to be quite uncomfortable, regardless of when the first time is that you do it. But if you just do it in small increments and sort of build yourself up to it, usually after a few nights of sleep on that side, it's usually feeling quite a bit better. In terms of what can people do to maximize their sleep after joint replacement surgery, I think there's a couple of fronts. One is sort of during the day, keeping busy. Don't nap. Keep yourself busy during the day. Try and get yourself back into a normal sleep-wake cycle as early as you can after joint replacement. I know that sometimes that's difficult. Occupy your day with small tasks to keep yourself busy. The second thing is get out of the house. Try and get back to your normal life or some semblance of your normal life as soon as possible. Visit friends, have friends visit you, keep busy. The next tack is really timing your medication regimen. So you usually have some anti-inflammatory medications as well as narcotic medications after surgery, and really timing them throughout the day to be able to take your last dose right before you go to bed at night. And that will usually give you several hours of a good, sound sleep. And I think the third thing is to try and develop a relatively normal pre-bedtime routine. So, not watching iPad, not watching the television, not playing on your phone immediately before surgery. Let your brain shut off a little bit, brush your teeth, get a shower, whatever you normally would do, and then go to sleep without much stimulation at that point.